to Meddkit's Provider Spotlight, where every single week we are interviewing the most amazing private practices from all over the United States. Every week we have someone brand new, a brand new perspective, someone else that's in a different specialty, and we get to hear what is going on with them, hearing their unique story. And so today we have two awesome special guests with us today. I am very excited to introduce you to Dr. George Attiyah and Mary Attiyah, owners of Beach Chiropractic Sports Center in Huntington Beach, California. Welcome, my West Coast friends. I'm excited.
Hello. Hi, thank you for having us.
I'm very excited to sit down with you two. And, something that I love to do in the beginning here is just talk about, your story, talk about, how you got here. You two have a very unique background within itself. So I'd love to hear a little bit about, how, what Dr. Attiyah, what had led you to open up your own practice, and Mary, how you got involved. So feel free to take it away, you guys.
Definitely.
Well, I opened the clinic about a year ago. So April 8th, I've been here officially a year. And I purchased the clinic from a previous chiropractor who went into retirement. And since then, it's been going very well. We're trying to expand a little bit more on our ability to bring the clinic a new life into more of a modern stage with chiropractic, spruce up the clinic a little bit, just modernize it a lot. And on our first date, I did not know this at the time, but Mary ended up working for a chiropractic clinic beforehand.
I did. So I have chiropractic background built in me. And I remember on our first date, he was talking about what he does and stuff. And I'm just sitting here still trying to be all nice and listen to him. I'm like, really? Oh yeah. This tool does this and that. This machine does this and that. And in the back of my head, I'm like, I know. I know.
So my usual, I'm going to be a doctor spiel didn't work on this thing. She said, you already knew everything. It's more of wait until he stops talking.
Then I can tell him.
Yeah.
And you're like, boom, this is what I know. I know exactly what you're talking about. And this is great. Yeah, that's awesome.
Yep. That's exactly what happened. But so using her chiropractic knowledge from her previous experience, it's now been incorporated into this clinic, and it's been very helpful, very successful.
That's awesome. Match made in heaven. I love that. I would love to hear a little bit about, in your practice, I would say when people think about chiropractors, maybe they think about, lower back pain or, shoulder pain, things like that. But there's so much more that meets the eye, right? So I would love to hear about maybe some of the common things that you help people with. Maybe some not so common things that maybe people wouldn't think about that you help address. And then, I'd love to know if you use, you had talked a little bit about this previously, but maybe there's some other modalities in the office that you use too to help aid your patients and clients to recovery.
Well, I like to promote myself as a very adaptable doctor. I like to think of myself as unique in that way because I really listen to the patients. I listen to what they have, what kind of issues are going on, why this keeps reoccurring. And I like to really take my time. I'm not somebody that likes to get people in, see them for 5 minutes, and then have them leave. I like to expand on that knowledge and allow them to really be themselves with me, open up to me, and really develop a relationship with my parents, patients. And so that allows me to have that time with them. So the first part of your question is common areas that people have with coming in to see me. I see everything head to toe. More commonly depends on the person and their issue pretty much. If it's a sports athlete, depending on the sport, I can see anywhere from shoulder to low back. If it's a hockey player, I usually see hips and legs. Runners, even, I see shins, calves, and ankles. So it really depends on the individual. older clientele come in as well, geriatric patients. So a lot of them usually have hip pain or low back pain. Some of them have even headaches or vertigo. So it really sky's the limit with how various this can be. But also, some less common adjustments that can happen are ears and thumbs. So these are adjustments that I like to give to patients who are, well, at least the ears, are give to patients who love to dive, who love to go into water, scuba diving. So adjusting the ears allows release in the jaw sometimes. It opens up the tympanic membrane, the eardrum, from muscles that could squeeze the eardrum. So it really helps with an equilibrium, allowing patients to dive a lot more quickly. And thumbs, we use our thumbs every day. Technology's been adapting. Yep, exactly like that. Thumb wrestling, you got to win. So adjusting thumbs goes a long way, and it provides a sense of relief. I've had patients tell me that they have never had relief in their thumbs like that before.
Really? You know what I think is so interesting is that, I've obviously we've been doing this for a long time. And, every week, like I said, we have, different specialties. And of course, we've interviewed other chiropractors, but you're the first person to
Yeah.
mention that they have adjusted someone for their ears. And
Yeah.
I love the way that you applied it. There's so many, you see a lot of athletes. There's so many people that are active, that do swimming because it's low impact.
Mhm.
you
Yeah.
know, they may not realize that these small everyday activities, and repetitive motions could be affecting them in a certain way. And so I love
Mhm.
the new perspectives that you bring to the table and that Mary has to bring to the table, just seeing people
Mhm.
coming in the office and, seeing them walk out and feeling so refreshed. It's so
It's
nice,
such a lovely feeling.
right?
Like,
The look on their faces
it's
or the reactions
so
they have during the end stage of the appointment is always a big
yes,
bonus for me.
yes.
Absolutely. So it's so nice to hear that you guys are doing such different things, which kind of leads me to my next question. I would love to hear both of your perspectives on how your approach is different. Mary, you have a lot of background. You've seen how other
Mhm,
people operate, and
mhm.
now you get to work with your husband.
I know.
Dr. Attiyah,
Mhm.
you have, an idea when you had opened your practice, you're like, hey, there's things that I have seen too, and that I want
Yes.
to incorporate to make this uniquely ours.
Mhm.
I want people to feel a certain way. I want to, work with people in a certain way. So what is it about the way you practice and the way that you treat patients that you feel is different that, that is unique to you guys?
Well, first and foremost, before I even get into that, one of the things that Mary liked to incorporate into the clinic was the use of insurance. This is not something that I ever saw
Mhm,
having into my clinic.
mhm.
But we live by the beach. A lot of people have insurance in this area. A lot of, I mentioned it before, but geriatric patients live in this area and look to retire by the beach. So a lot of them have Medicare or a secondary insurance. And like I said, it's not something that I saw having in my clinic because chiropractors aren't really paid very well with insurance. More of them are cash based. So having insurance in the clinic, and that's where Mary's expertise comes in. The former clinic she used to work at involved insurance.
Mhm.
So having her and her opinion step in and accept the insurance into the clinic has really brought forth a plethora of new patients that I never expected to see in the clinic, and it's been a very very good inclusive um, part of the clinic.
I love that. It's
Yeah.
so nice to, of course, I understand why people do cash pay, but it is so nice also to offer access to people. And sometimes that's what
Yeah.
insurance is, there's, like you said, there's an older population and they really rely on using their, medical insurance to be able to pay for some
Yeah.
services that they need. And I think, I know that insurance is complicated. It can be difficult, painful at times to deal with,
Very.
but when it can work in your benefit, and also helping, people get referred to great providers like you guys, but then also using it to get access, to something that
Yeah.
they wouldn't have had before, that's an amazing thing. So I love that that is an important part of what you guys are doing, within the practice. Something that I absolutely love to talk about, which I feel like we just hit a myth buster in there, about insurance and about access. So I'd love to hit us with another one. I think all of healthcare, every specialty has its, wives' tales, old wives' tales, and
Yeah.
you get lumped into a certain bucket about how people feel about you based on their own experience with maybe with someone that wasn't as kind to them, or they heard something through the grapevine through a friend that didn't have a good experience,
Mhm.
whatever. And then you wrap all up into a bow, and then you have Google and WebMD and
Yeah.
ChatGPT, right? So it's great that people can go look up things and be invested in their health, but it's also hard when there's a lot of misinformation out there. So I'd love to
Yeah.
know from you both and from your backgrounds, what are some of the myths about chiropractic, or maybe just about what you do, and debunking some of them? What do you hear commonly?
Would you like to start?
I think the most that I've ever heard is, "I don't hear the cracking, so you have not adjusted me."
Oh, that's a good
Yeah,
one.
yeah, I hear that all the time.
And subsequently, we also hear, wait, I don't want to be cracked. I don't like the noise. So, um, what the cracks are, and I'm putting that in quotes here, is actually called cavitations. These cavitations are gas being released from the body. So most people interpret it as bones breaking. We're not breaking your bones. We're opening joints, and every time you open a joint, gas is released. However, the more you use that part of the joint, the more gas that gets released. If you don't use the joint enough, there doesn't have to be that much gas to release. It also can imply that a portion or a segment or vertebra of that area is staying within the confines of normal in that person's body. So when it stays normally and you don't hear the gas as much, it means that your body is recognizing that this is normal for me. I should be in this location.
Interesting.
It's
Yeah.
very interesting.
Yeah. So the other myths are they're more about the intelligence of chiropractors. Chiropractors are quacks. Chiropractors don't know what they're doing. Chiropractors are this, that, and the such. Chiropractors still, even from 1920, after chiropractors were starting to be more um, seen, and not even until 1990, I think it was 95, chiropractors were given the opportunity to get doctors' degrees. We still have a lot to prove, and that's okay. It just means that we're growing, and hopefully we grow in a way that people are able to recognize that you would like to have us. If you don't, then we're not a good fit for you. But we're not going to turn you away if you need help. But ultimately, we're here to help. We want to be there to help. But chiropractors study 450 hours minimum in the 3 years of schooling that we have, maybe even 4 sometimes.
Keep in mind, it's more than medical doctors.
Yeah, it is a little bit more than medical doctors.
They do more hours.
And we also take 5 board exams that allow us to get our licenses as well. So it's more than medical doctors. It's more than doctors of optometry. It's more than physical therapists as well. So we take 5 board exams. We take a state license exam, and for every state that you're in, you have to take that state exam as well. So 6. You got it.
Okay.
So we really have to know our stuff in order to be in this field. And we have, like I said before, we have a lot to prove, and we have no problems trying to prove ourselves because we know that we're relevant. We know we're in this field, and we see people having great reaction to this stuff. And that's what we look to incorporate in any chiropractic aspect.
I really love how you debunked all that, because I do think those are a lot of maybe the common things that get thrown around, but also meeting it with the truth and, all the backup that you need to say, hey, we are relevant. This is how much we study. This is how many exams we have to take just to be able to practice here, to be here, which is a lot. I mean, you came up with that's a ton. And I don't think everyone knows that. I think people just, maybe this is just a 4-year school and that's it. Maybe you have to just do one test and boom, you're in, you're in. And I don't think everyone knows all that what goes into. I think for any physician, for anyone that's practicing, I don't think people can quite comprehend how comprehensive their schooling has been, what they have gone through, mentorship, rotations, all these different things that you have to go to be able to treat someone every day and do it
Do you
well.
mind if I do you mind if I ask you a question?
Yeah.
When you think of a chiropractor, what do you think usually?
For me, I think about pain. And I think about actually chiropractors solving and I love that no one's ever asked me a question. This is so cool.
Yeah.
I love it. I think about finding the root cause of that pain.
That is what we
Actually
do.
about it like going away. And so that's what I think, because I think about more about the opportunity than I do of the
Yeah.
downside. And I think it's, all about, who you match with, who you feel like is a good fit for you to see, who, maybe there's a chiropractor that has a certain technique that that you're interested in or that you've researched about, or maybe you've seen another chiropractor that doesn't do it, but said, hey, I don't do this, but this is what you need. And here is a good referral for you. This is who I think you should see. And so I think maybe what I'm trying to get out of it is talk to people, learn, educate, ask questions. And I think for you guys, you enjoy that. I can see how much you want to help people. And obviously you want to talk to people who are engaged with their health, because those are going to be the really great clients for you, because they want to get better. They want to get out of whatever state that they're in, and they're motivated. So
yeah, definitely.
Absolutely.
And it's more of like, we're used to when we have headaches, we refer right away to medication, Tylenol, Advil, etc. But you'll have relief for like what, 8 to 12 hours, it'll come back again. What I love about chiropractors is it could be something else that's misaligned in like your neck or something. They adjust it back in, perfectly fine, like nothing ever happened, instant relief.
I totally agree with you guys.
It's something to say that I have pain somewhere. Why are you adjusting my spine? It's all connected. Okay, there's a scientific aspect of it. The easy answer is there's always a connection to be made from somewhere else, and that's why most chiropractors focus on the spine. Me personally, I work head to toe. I work anything that I can. I work out the areas. I lead it back to the spine, and if deems necessary, explain why. Most people associate chiropractors with back pain. That's literally it. Oh, I don't need my back cracked. Okay, great. You might not need it, but it doesn't mean that I can't check the rest of you, make sure you're okay. Saying that a person only has back pain is literally 2% of what chiropractors only do. We work, where's the other 98% of the body? It's like taking an instruction manual to a new computer or a microwave, or not reading the manual because you know the general thing about what to do with a laptop or a microwave. But then you read the manual. You're like, wait, I didn't know that I can also do this with that. I can go on the computer and look up something on the internet, on YouTube, while also doing my studies. That's not something somebody ever taught me. So it's reading the manual, knowing that we do more than just back pain. And it's a very big difference.
I think so too. And, because you're throwing out so many good tips and pro tips, I kind of want to, round off today with a really fun question that I think both of you might have some different opinions on, coming from both of your respective backgrounds. But, I think, if someone's coming to see you and, you might give them some homework or some things that, hey, these are some things that would, better your health. There's all things today that we can work on, right? That are so easy. And maybe we just don't think about how easily they are to do. And so maybe for the patient side of things, I would love to know what kind of pro tips you have for us, our everyday people, that can just move our health just slightly in a better trajectory. Obviously, hey, we're everyone's busy. We forget to do
Mhm.
certain things. We're living in a world where we're more sedentary. We know that has effects, but anything that you can get from the patient perspective on what we can do to better our health, that would be great. And then here is the two-part question. So, because of the nature of what we do, we obviously have a lot of great providers that watch this as well. And so it's always nice to hear from provider to provider, what are some
Mhm.
pro tips for people on your spectrum of things, on your end? Is there something that you do in your practice that you're like, man, I couldn't live without this. I have to do this every day. This is, this is maybe something I have on my intake paperwork, and this is the best thing I've had to help, solve, some of my patients' ailments because, this bit of information has been so helpful every single time.
Mhm.
Whatever it might be. It can be something so silly and maybe in your mind, but it's so effective that
Mhm.
everyone should know about it that's practicing. So I'd
I already have my thought.
oh, okay, great,
I'm
great.
so ready.
You're so ready. Well, I'm so
I'm
ready to
so
hear it.
ready. So, um, a part of being a doctor is endless amounts of paper and having to do that. And insurance is no different. You have to have paperwork for that. There's patient notes that we have to do. That's the paperwork side from the doctor. And then there's the insurance notes, what you send to the insurance companies to allow them to either have more visits or explain why something was not paid for that should have been or because it was covered. So there's a lot of paperwork involved, especially running your own business and being in this position. One of the things that has helped me, and I cannot thank it enough, is having an AI scribe. Having an AI scribe in the clinic. This one is specifically for specialty doctors that use SOAP notes. SOAP, subjective, objective, assessment, and plan. And this AI scribe that I use, and I don't know if I'm allowed to say the name. Am I allowed to say the name of it? Or just
Of the website?
yeah. I use an app called Freed. Freed is an AI scribe app that allows doctors to openly communicate with their patients and records the conversation in real time without taking our side conversation, listens in for the medical notes aspect of it. And by the time we're done, it gives you a time duration of how long you were with the patient. The AI generates a summary, the SOAP of the SOAP note, a summary transcript, as well as a full transcript of the entire conversation within the time span that you had with that patient during their appointment. And this saves me hours of having to write down notes. And I kid you not, maybe 4 hours a night of having to write down notes. And this allows me to have more time for other things, working on the insurance notes, making sure all my patients are set for the day, even the day after, spending time with my wife when we're not working. It has been a huge lifesaver. I highly suggest having an AI scribe. AI is starting to take over a little bit more. It's being seen a lot more commonly today, but I cannot thank this app enough for all the time it saved me.
That is an excellent pro tip. Obviously, a part of what we do, we are using AI too. And there's great, I think there's some people that are afraid of it, and I get why. But if you use it in the right application and safely,
Mhm.
and
Mhm.
for the right reasons, it's a really useful tool, and it's going to become more important, not less important, even more important as
Yeah.
you know as years go on. And so it's important I love how you're adopting this already because it is, our world is constantly evolving. And so it's good of you to, get a leg up and feel comfortable with it and use it to, record your conversations, to get your notes down. And I'm sure it helps you, you know, it enables you to spend more time with your patient in a
Mhm.
quality manner because you're not stuck. Okay, wait, what'd you say? Or like, okay, I
Well,
Yeah.
I'm also
forgot
not looking
that.
down. I'm also not looking down at my notes. I'm also not writing stuff down and looking away from the patient. So it allows me the opportunity to speak with them on a more personal level without having to look away, without having a barrier like a notepad or the patient's previous notes in front of us. So it's been fantastic to have that as well. And even from the patient side of things, I have had patients tell me no, that they wouldn't like to have it on. But every single patient, I don't care how many times I've seen you, I will ask you, is it okay if I turn on my device? Doesn't matter how comfortable I am with you. If you're not comfortable with it, I'm going to turn it off. I'm not going to have it on, and I will go back to the old way.
Yep.
But from a patient's perspective, from a doctor's perspective, it's very helpful that I have it. But if the patient's not comfortable with it, they're my first and foremost. If a patient's not comfortable having it on, I'm not going to turn it on.
That's awesome.
Did you have a patient's perspective on this? Not the app, but on her side of the question.
Just in general, a lot of patients are very misinformed about chiropractic. So, like, for example, patients who have scoliosis, chiropractors can help with it, but they just come to us when it's like when they're already older. Correct me if I'm wrong, you can adjust them or fix the problem before they're 25, before it stays the way it is.
What he's referring to is scoliosis, scoliotic patients, especially in young female patients. Females have a little bit more flexibility in them, and they find different ways to sit. And Mary was accustomed to this at her young age as well. But young girls about early adolescence, 12, 13, going into high school, they sit in funky ways. They sit with their knees up. They sit on little bar stools, make sure they have enough surface area for a leg to be up on the stool with them, and to make sure that their posterior is sitting on the seat as well. And that can tend to form bad habits and misforming of the spine. The good and bad news with this is the good news is if caught early enough, they can be adjusted to not have scoliosis or misalignment in their spine going into adulthood. The bad news about it is if caught after the age of 25, the spine is more rigid and it stays in place, and most people stop growing at the age of 24. So growing up after the age of 25, if you don't have help with the scoliosis from prior hands, you live with it the rest of your life, and most people have to resort to surgery and keeping the rigidity of their spine to make sure that it stays in place.
No, that makes a lot of sense. And Mary, thank you for, shedding a light to some women's health here,
Right, exactly.
Gotta stick up for our ladies here. And
Yes.
I think that's a really good pro tip because, there's so much, we think about the pain now, right?
Yeah, yeah. And also, like, a lot of patients do not know enough about chiropractors. They do not. Like, even before me I worked with about almost 13 different chiropractors. So right after I got my degree, I went straight into working for chiropractors, and a lot of patients don't know about it. So it's like I know a lot of people in my life, and a lot of people are not familiar with chiropractors. So it's like I want to let everybody know. I want them to know what they do, how beneficial it is for them. So it's like all this stuff that you're experiencing, you could go through like the natural way.
100%, and I think it's great that you bring it up as a really good pro tip because, as I was saying before, people, we tend to think, oh, we're feeling this pain now, but what if we could, go back in time to 10 years ago when you were a kid and there's all these, preventative things that we can do to help ourselves. So, as you're saying, Dr. Attiyah, as girls, we tend to be more flexible. We can sit in all different ways and, we're doing all kinds of things. But that can maybe later negatively affect, our spine. But if parents could know that now, get good information like you guys are telling us and say, hey, you might want to watch out, this is how I might correct that now.
Yeah.
So that, your little girl who might turn out to be an athlete has less hip pain, or less lower back pain. And if we can kind of make these subtle changes now, then she will be better off in the future. So I love, Mary, that is such a good pro tip that chiropractic is not just about addressing the pain now, it's being preventive about it. And so we should definitely be thinking about that more. But you too, I've loved this chat. This has been a thing. Before we leave off today, I'd love for you to tell folks where they can reach out to you guys, where they can, message you for more information, and that will be that. I love it.
Thank you. Before I do, I forgot to mention one thing.
Sure.
I realize now I didn't mention what techniques I do or anything. So I am a doctor of chiropractic that focuses on sports athletes, but I do see a patient diversity between 7 years old and 92 years old. I focus on diversified technique, extremity technique. I'm getting certified with being proficient with extremity adjusting, drop table, and activator adjusting. So I cover the table with a plethora of adjustments and techniques that allow me to be able to be there with patient comfort. But you can find me on Instagram at Beach Chiro SC. I am working on a YouTube. I am working on getting up on TikTok. I am currently working on my website. It is up, but it's not updated with my information yet. But I am in Huntington Beach. I'm 6 minutes north up on Beach Boulevard, and you'll find me over there.
So that means come get adjusted, go to the beach and relax.
That is amazing. Thank you so much, Mary and Dr. Attiyah. It's been such a pleasure interviewing you both, and hope to have you on again.
Yes, definitely.
Thank you.
We'll look forward to it.